It's important for us, I think, to recall that there can in fact be something like transformation that grows out of a tragedy.
In June 2002, Sophia King was tragically shot and killed by Austin police officers after exhibiting dangerous behavior. Sophia was just 23 years old, a mother of two, and frequent user of both the criminal justice and mental health systems. Over the next 2 years, her shooting caused community leaders and public officials to review police use of force, the community's response to the mentally ill, and elements of social care that they encounter. By August 2004, Austin Mayor Will Wynn, in conjunction with the Hawk Foundation of Mental Health and Integral Care, assembled the Mayor's Mental Health Task Force to document and track progress that would move Austin to a national model of a mentally healthy community.
The city manager, or the deputy city manager, Michael McDonald, and members of the Hawk staff suggested that we should also focus on making the city of Austin one of the mentally healthy cities in the United States as well. So we had a series of meetings with both the mayor, the deputy mayor, Michael McDonald, and a number of other people from the community, trying to figure out what constituted criteria for a mentally healthy city.
This group of 80 individuals, representing over 40 agencies, met for 4 months to develop 39 criteria. Led by former Texas State Representative Wilhelmina Delco of Austin and former Austin Mayor Gus Garcia, the task force comprised of 4 subcommittees: criminal justice, short and long-term treatment, housing, and education and community awareness. Within a year, the Mayor's Mental Health Task Force report is released, and the Mayor's Mental Health Task Force Monitoring Committee is appointed in May 2005. After an extensive selection process, Dr. Susan Stone was chosen to lead the task force for 5 years. The committee then identified a scientifically based set of behavioral health community indicators. These indicators were tracked annually through a mentally healthy community scorecard and received national recognition from peer-reviewed journal articles, advocacy organizations, and media. In 2007, the monitoring committee was chosen as a beta testing site for the mental health jail diversion cost simulation study. This brought national attention to the Austin community with regard to innovative approaches and cost analysis related to the interface between mental health and criminal justice settings. While the original focus of this committee was to coordinate planning activities across multiple service systems, Dr. Stone's leadership led to an eventual outcome of data development around community progress towards specific behavioral health goals. This led to the development of nationally accepted community behavioral health indicators. A long list of community progress was made, such as the implementation of the Suicide Data Project, a collaborative between the City of Austin and Integral Care, and the development of financial modeling report for permanent supportive housing that resulted in a city resolution committing 350 units to homeless individuals in Austin. At the end of the original 5-year charge, an ad hoc group of community leaders reinstated the committee's work for an additional 2 years. Subsequently, the committee, now known as the Mental Health Task Force, was charged with identifying ways to utilize the research developed on the indicators to create sustained community action, known as the Indicator Improvement Initiative. New and increased financial support for this initiative is provided by 6 entities, including Integral Care, Bethlehem Center for Mental Health Law, City of Austin, Hawk Foundation for Mental Health, St. David's Foundation, and Travis County.
My predecessor, Mayor Will Wynn, established the Mayor's Mental Health Task Force, and I've been very proud to continue it.
Over the course of the last probably 2 or 3 years, I've seen a number of their reports, attended some of their meetings, and I'm delighted with the direction. I think they have gone much farther than I probably imagined in 2003 and 2004, and also maybe farther than they would have imagined as well.
Today, the Indicator Improvement Initiative carries forth the work of the task force by working to create community action plans around complex, multifactorial, and cross-agency issues that impact individuals with behavioral health disorders. 5 indicators were identified and met the criteria to drive system change: criminal justice, youth, access, housing, and substance use. Complex, multi-agency problems require collaborative responsibilities for system change. Local organizations have taken charge to report and accurately assess each indicator area. Significant efforts have been invested in the past year toward building community support to implement system changes around these issues. The next year of work will entail further data development in each area, exploring geographic mapping of patterns, and moving forward to promote sustainability of system change efforts.
We're beginning to make progress, and that's due in part to the efforts of all of these groups working together.
This work could not have been done without the support and dedication of all those involved with the transformation of the Mayor's Mental Health Task Force Monitoring Committee. 8 years ago, Austin took a giant leap toward improving the state of our community's mental health, and it is with this determination the movement will continue into the future.